What is the responsibility of the dentist, practice owner, when reopening a practice after COVID lockdown? First and foremost, the safety of patients and our dental team as well. To begin with, we have practiced what is called universal precautions for decades. What does it mean? Universal precautions assumes everyone has every communicable disease there is, so you take accordingly all the precautions. And yet, what is new about COVID? COVID, or the corona virus, the so-called SARS-CoV-2 virus, is newer. We don't know much about them. We keep learning new things about it all the time. It is said to be more infectious. It is also said to be much smaller virus particle. So what do? We added several things on top of what we have already done. For one thing, all of us have been completely isolated during the entire lockdown, and I also went and had a test done, the really uncomfortable one, where the swab goes all the way up. I had that done just to prove that I'm not infected. It came out negative. And on top of that, when somebody makes an appointment to come, we ask several questions, such as, have you been ill in the last 2 weeks? Have you been taking care of anyone that's been ill? Any coughing, fever, chills, fatigue? All those questions, the same questions from Centers for Disease Control. And once they come here, we first take their temperature on the forehead with a no-touch thermometer to make sure they don't have a fever. It has to be below 100. And then on top of that, we also take a pulse oximeter reading for the blood oxygen level at that fingertip. One of the many things we hear about COVID is it interferes with the circulation, especially the extremities, toes and fingertips. So we measure that. Only if those two things are passed, actually those three things, if they answered yes to any other questions, we reschedule appointment. If they have a fever, they get rescheduled. If they have low blood oxygen level, also get rescheduled. And then they come to the back. And one of the things that they recommend is you see one patient at a time. What I mean by recommendation is there are science-based good recommendations from the American Dental Association, Centers for Disease Control, the White House Corona Task Force, a lot of valuable information. They all say you see one patient at a time, not have two more people in the waiting room. Well, that's not hard for us. As a TMD practice for over 20 years, we always saw one patient at a time anyway. That's an easy one. Then once they get through these gatekeeper steps, if you would, when they go to the back, we have them rinse with 1.5% hydrogen peroxide solution for 1 minute. And this has been shown to kill coronavirus. Then when we actually do treatment, we added more things. The N95 masks, they're hard to get. We have some of those that we're using. We also have other similar devices, and I have some photos later to show you. On top of that, when we are using anything that can produce aerosol, such as using a handpiece, the high-speed drill, anything like that, we also have added a face shields, and then PPEs, the whole thing. Also added a specialized room air purifier. This is supposed to be good for 500 square feet. I have 2 of them in each room as we use them. Again, we see one patient at a time anyway. We just move them as needed. So all of those additional measures are there so that we can be sure we're doing everything we can possibly do. Anything else I left out? I think I got them all. Well, all of these, we're fairly confident we're doing everything we can possibly do to absolutely mitigate the best that can be done any risk to patients and then us also. Having said all that, we had to put all this in perspective. There are many studies done of antibody tests, large-scale antibodies, the general population in several parts of the United States. What they have shown is many, many more people were infected with the coronavirus, estimates that 50 times to 85 times more than we thought we had, people that are already out there infected, they never even knew they had it. Then some of the other new information comes up. It looks like we may have had coronavirus among us as early as December of 2019. And yet the closure and so on didn't happen until later in March. So all those times, people are going to dentists. They were seen by dentists using the usual the universal precaution we had for decades, and yet there's no evidence, a single case of dental office transmitted COVID case yet. So you know that must be okay even before we did add all those things. One more thing. Back in March, first week of March, March 5th through 7th, in British Columbia, in Canada, their dentist named Dennis, what is Dennis's last name? Dennis Vincent. There's a dentist from dentist from Vancouver, Canada, went to a dental conference in Vancouver. It's the largest dental conference in Canada. Over 15,000 people come there. He went there. He was not feeling so wonderful, but he's okay. So went to the conference and met people and so on. Then he went back to his office and practiced for several days. And then he fell ill and passed away. And then there was diagnosed he had COVID. Then they did a contact tracing and they were able to find 30 different people that he met at the conference who are infected. What is interesting is all those people he saw as patients in his office, they were this close to him. He wore the usual precautions all of us have been doing, masks, gloves, and all that. Not a single patient got infected. What that tells us is it is not as easily transmissible in a dental office setting, which is already been using the usual protocol. On top of that, we added all of this. So we are, without any doubt, done everything we can possibly do to mitigate all this risk. And I wanted to share this with you so that you have a certain level of confidence you'll be okay.